Well, we are delighted to have Dr. Asiodu and Mariana Boyer, both here from the University of California, San Francisco, and the Milk Research Lab. I'm so excited to see some of our familiar faces as well as some new ones. If you would go ahead and mute yourselves, please, to avoid any background noise. Thank you. For those who are new to NICU Parent Network, we are a US-based professional organization for NICU parent leaders who collectively support and represent the needs and best interests of NICU families. And together, we envision a world where all NICU families are essential and integral members of their baby's care team. We have about 40 organization members across the country and around the world. And one quick announcement before we jump into the reason everybody's here. We are excited to be able to return to our in-person conference this fall. This will be our 10th in-person conference and our 14th conference overall. Registration is currently open for NPN members, and general registration will open June 15th. So this is one of the only events that we know of that is specifically curated for NICU parent leaders, bringing together that unique experience of the lived NICU or bereavement experience, and those who are now running those organizations and programs that are providing hope and light and support for NICU families everywhere. So just a quick reminder, this webinar is being recorded. If you have to leave early, we will be sending out the link afterwards, and it will be available to view later on our website. Please put any questions you have for our guests in the chat box. And so let's go ahead and begin. I'm going to stop sharing my screen so that Dr. Asiodu can share hers. With a quick introduction, I am just delighted to welcome Dr. Asiodu, who is an associate professor at the University of California, San Francisco. Dr. Asiodu's work is focused on identifying and addressing the impact of social and structural determinants of health during the reproductive life course, with a focus on human milk feeding, lactation support, contraception, and maternity care practices. She is also joined by Mariana Trujillo Boyer, who is mother to twin NICU graduates, currently breastfeeding and pumping for a singleton toddler, a graduate student research for UCSF Milk Research Lab, an inpatient registered nurse, certified lactation specialist, and a recent graduate from UCSF with a Master's of Science in Health Policy Nursing. So Dr. Asiodu and Mariana, thank you so much for being here today to talk about this critical topic. It's particularly important to our members and our audience here because we know that Black families are much more likely than their white counterparts to deliver preterm, to experience infant and maternal mortality, and to even receive poorer care in the NICU. So before we get started, I also just want to acknowledge and thank everybody for carving out time to be here today. I want to thank our NICU Parent Network members and attendees for recognizing the importance of this topic and also for the work that you do day in and day out for NICU families. So before we get into the bulk of the presentation, Dr. Asiodu, I would love for you to share just a little bit about how you first became invested in focusing your work in this area.
Hi, good morning, everyone. Good afternoon, depending on where you are. I'm coming to you all from campus this morning here at the University of California, San Francisco. And just thank you, Kira, for the invitation. I know we had been planning this for some time, so I really appreciate the opportunity to be here with you all today. In terms of my work or how I got to really focusing on, or the interest in terms of focusing on infants and families in the NICU, it really came out of my postdoctoral work. After completing my PhD here at UCSF, I completed my postdoctoral work in Chicago at the University of Illinois at Chicago. And during that time, I spent actually most of my time in the NICU at Rush University with Paula Meyer, Dr. Meyer, and her team in the NICU. And it really opened my eyes to the differences that individuals and families with infants in the NICU experience as it pertains to being able to provide human milk to their infants, in addition to challenges related to lactation, but also resources and things of that nature. And so it's been I think that was basically it in terms of my time in Chicago really shifted my trajectory and just perspective overall in terms of really wanting to shift and focus more on being able to provide resources to families with the most vulnerable infants in the NICU.
Mm, thank you. And Mariana, I would love to hear from you as well. You know, we mentioned in your bio that you have the lived experience as a NICU mom yourself. Was it that propelled you into this space?
It definitely was. I was an advocacy intern before I got pregnant with the twins for the food bank, and I saw how firsthand, really, how community engagement really makes a difference. We passed a law where we went to the Sacramento, the capital, and advocated to legislators and taught community members how to advocate to get CalFresh benefits, which is food stamps to SSI, so Social Security recipients. And I saw like a major impact on how community engagement does. And then when I had my twins, I saw nursing and I decided to apply for nursing school while I was admitted to keep the babies in. And then my NICU experience, I really felt alone. I felt like a lot of the education was very fast. I felt like I wanted to make a difference in the NICU. And then when I went to UCSF, I actually started my research residency and then my policy residency with the Milk Research Lab. And that's how I got into this work.
Wonderful. Well, thank you so much. So with that, I will just go ahead and turn over everything to you, Dr. Asiodu, and we will take questions as they come up and at the end as well.
Wonderful. So thank you all again for this opportunity to be here with you today. This topic, as we shared, is really important and of interest to us. And so we've prepared a few slides, but we do also want to make sure we have time to be in dialogue with you all. We did receive the questions that you sent, so we're really looking forward to a really robust discussion. So Mariana and I are here to talk with you all about exploring lactation and birth experiences of Black families in the NICU. And hopefully you all can see my slides. Okay, and they're in the right view. Okay, great. We do not have any conflicting financial relationships to disclose. We do want to acknowledge, yes, we do want to acknowledge our study participants, our community partners, Mighty Little Giants, and Glow Preemie, the entire research team, and our funders for this project, the LIPS Family Fund and the California Preterm Birth Initiative. Here is a list of the entire team in regard to the Milk Research Lab. Mariana, who's here with me, but then we also have another group of graduate student researchers, our data analyst, and Carol, and we have a group of colleagues who were here and supported the NICU study who are no longer with the Milk Research Lab at the bottom. For today, we're going to talk very briefly in regard to the importance of this work and significance and how we got here. Given we know your lived experiences and the work that you all do, we'll talk briefly about the NICU study. Mariana will go into further detail about the toolkits, and then we have some time for reflection and Q&A. And just as a content warning, again, we know you all have lived experiences, but we also think it's important just to orient folks in terms of the imagery and the lived experiences that may be shared as we're going through this presentation may be a little triggering. And so we do hope that folks do what they need to do to support themselves. In terms of thinking about this topic, in terms of why the neonatal intensive care unit, it's important to note that between 10 to 15% of all infants in the US are admitted to the NICU at some point after birth. And so that's anywhere between 360 to 500,000 infants a year, which is significant. And there are a number of reasons why infants are admitted. Respiratory distress syndrome, difficulty birth, sepsis, birth defects, feeding issues, maternal and infant infections. But we know one of the main reasons and the number one reason why infants are admitted to the NICU is preterm birth. And we also know, unfortunately, due to lifetime exposure to systemic and structural racism, in addition to experiences with obstetric racism and obstetric violence, that Black women and birthing people and Black families are at greater risk for some of the inequities and poor birth and outcomes that I shared on the previous slide. And unfortunately, we know that there are disparities in access to and quality of perinatal care. So care received during pregnancy, during the birthing experience, during postpartum, and then post-discharge. And we also know that unfortunately our racialized, racially minoritized families have increased exposure to environmental hazards and climate-related disasters that also put them at further risk and exacerbate some of the perinatal inequities and disparities that we're talking about. And subsequently, Black families have the highest burden related to poor maternal and infant health outcomes. As mentioned in terms of preterm birth, but low birth weight, very low birth weight, infant mortality, also maternal mortality and morbidity, and also in regard to lactation and thinking about breastfeeding and human milk feeding, initiation, duration, and exclusivity. And so understanding that, but then also coupled with interactions that we had with our community engagement specialist, Brandy Gates Burgess, and she was sharing with us experiences that she was seeing in being able to serve and support NICU families in the hospital she works at. We decided to come together to initiate and conduct the NICU study. And the purpose of the study was to provide, to improve equitable access to lactation support and perinatal mental health services in the NICU settings for Black mothers and Black birthing people and families in general. For that study, we primarily recruited folks who self-identified as Black and/or African American, who had a recent NICU or current NICU experience. When we first launched the study, we limited it to folks who had had an experience in the last 2 years, but we received great interest from individuals and families who had a longer NICU experience and wanted to participate and felt that their experiences could really help improve and enhance our perspective in regard to the lived experience. Again, when we first launched the study, we primarily focused in California, but again, we were hearing from families across the country that they too wanted to share their lived experiences related to the NICU study. This was a mixed method study. We launched an online comprehensive survey that had a number of different domains that focused on not only the NICU experience, but prenatal care, the birthing experience, lactation, mental health, experiences with racism and stress and depression and stress. And so it was a very comprehensive survey. The questions were tested and revised. We engaged with community partners to get their feedback to make sure that we were really asking questions that were specific and of interest to NICU families and NICU experiences. In addition to the survey, we also conducted interviews. Interestingly enough, almost every individual and our family who completed a survey opted into wanting to also participate in in the interview and share more qualitatively their lived experiences. However, we reached data saturation after around 32 interviews. And so unfortunately, we weren't able to interview all of the families who had opted in or acknowledged that they wanted to participate in that sense. We also conducted descriptive statistics and thematic analysis of those findings. And in terms of our findings, we really highlighted on 6 specific themes that really came up and were robust in our data. The first being around emotional health and mental health. That was a very clear and consistent theme, both in the quantitative data, but also in the qualitative data in terms of the stress, perinatal depression, the birth trauma that families and individuals experience, not only with themselves, but with their infants, and the lack of mental health resources that were available. Second was in terms of infant feeding, and folks unable did not necessarily have the resources and support needed to meet their human milk feeding goals and or lactation goals. So we heard a great deal of not necessarily having lactation consultants or lactation support or breastfeeding peer counselors, things of that nature. And unfortunately, coupled with that, majority of our participants didn't have access to donor human milk either. And no one talked with them about that. That was a very significant theme in terms of many found out about pasteurized donor human milk after their NICU experiences. And so again, a huge inequity in terms of even if, and we appreciate and understand that not all NICUs or hospitals have donor human milk or are in relationships with milk banks, but even in those instances when they were, these families, providers and staff were not discussing the importance or the utilization of donor human milk with the families in our study. Families also shared that they experienced racism and biased care and discrimination during their time in the NICU and during the perinatal period, and very specific in the ways in which they were treated and not treated and not listened to and heard, that in this very vulnerable time, that even their mere presence in the NICU environment was often challenged, especially if there were skin tone differences between the parents and the infant, or they weren't there enough or perceived that they weren't there enough due to other competing priorities with maybe other children or work or things of that nature. Just very much felt that they were treated differently and unfairly, and resources weren't shared equitably with them. Also, in terms of resources, community resources, folks also shared that they didn't know what they didn't know, and found other resources were being shared with parents and not them, but also not being aware of what community resources were available to be able to support them during this time. And then lastly, advocacy and policy. Parents shared how important it would have been for them to know what their rights were, what the policies of the hospitals in those environments. Again, there was just a lot of lack of communication that really impacted the care and experiences that these families received. And so with that in mind, we decided and heard from our participants and community partners that we really wanted to utilize our data, not only to write papers and manuscripts, but to create some type of resource or toolkit that could be useful to help Black families and Black women and birthing people navigate the NICU experience. So with that, I'm going to hand it over to Mariana.
Hello, everyone. So, yeah, piggybacking off the NICU toolkit, we had we were like, what's next steps? We really, our community specialist, Brandy, was like, well, we can't make, another paper manuscript. We really need to get something that will be benefit to the community members. And I agreed with that. And she and I thought about this toolkit, and it's just something that because as community members, we don't always have access to papers, we don't always quite understand it, and the needs for the community members that are living these lived experiences are a lot different than researchers. So we thought it was super important to make a NICU toolkit based off the themes that we found in our toolkit. We split, at first it was going to be one long toolkit that was going to be for families and hospitals and birth centers, but we realized that there's a lot of content, and we wanted to separate it because we understand that Black families, we can give them all these tools, but we also need to give birth centers and hospitals and people that support Black families resources and advice on how to support them and navigate systems of structural and systemic racism, and what they can do to combat that and help that and kind of dismantle those structures. Each section under each theme, we would start with a did you know? So it's an important fact about the topic. So it's usually a fact that we found in our study, and then national data. A lot of them have quotes from the lived experiences of our NICU study participants. And then it goes to the next part where how you can prepare. So it gives them tips, resources, strategies on how to navigate being in the hospital, and we have resources under each section as well. And all of these are thoroughly researched and backed by the literature. And then each toolkit ends with a robust amount of community resources for each sections, affirmations, and words of wisdoms from our study participants. We thought that was very important to add. Next slide. These were the major themes. So we did hospital stay, emotional health, lactation, donor human milk, racism and bias, advocacy and policy, community resources. And in closing, this one specifically, the themes for the hospital and birth centers. And each one, again, goes through a fact and how they can prepare. And we end this with this really important thing is a checklist of what your organizations can do. One of them is provide critical NICU information at admission and assess ongoing needs. A big one is like checking for mental health status. That is a big one. Trying to, even read your needs of your patients, and also being culturally responsive resources, making sure you know what's out there, what community organizations are out there to help specific Black families, to know what they're going through and help give them support that they need. A big one is engage in anti-racism and culture humility training. There is a legislation with SB 464. It's specifically to L&D and postpartum units, but everyone definitely gets anti-racism training clinically. I also encourage your organizations to make sure that you have anti-racism training and culture humility training at least every 2 years. And then a big one is connect families to culturally responsive community resources. There is a ton of community resources. We do not need to reinvent the wheel. We can just support the community organizations that are out there doing the work, and ask and always ask. I think this is a big one, and this is how we created the toolkit, right? We created this toolkit, and then we asked for focus groups and asked them, hey, is this what we wanted? Is this what you like? And some of them were like, we don't like this. One of them was, a big one was like full-term infants in our NICU toolkit. They really thought that that was triggering. And I forgot that I personally had that experience. My sister-in-law had a baby 8 days before me, and I didn't realize how much my nephew would trigger me. And so I completely forgot even making this toolkit that was my experience. And so when we asked for feedback and that was an experience, we made sure, hey, we need to get and find preterm infants and, infants with, the cords and everything that's the real life NICU experience, and then making sure that we have those images because images matter. And so that's why one of the most important things is ask for community feedback, because they're the ones with the lived experiences. They're the one that's going through it. And we want to make this resource that's for them, and that would be best, made for them. And that would be having them at every step of the way of creating something like this. And so the NICU toolkits utilizations. So we're sharing the NICU toolkits on, some facilities are sharing them on admission or at discharge. We're also using the NICU toolkits to support quality, improvement activities or unit department improvements, and then facilitate important conversations in organizations, but also in your communities. Organizations that are nearby and just, throughout are going to be our Mighty Little Giants, Glow Preemies, reaching our Sisters Everywhere, Sisters in Law, Loss, Saul's Light, and Alliance for Black NICU Families. These are definitely organizations you can partner with and reach out and see if they want to become NICU parent leaders, and just end up doing the work with them and helping them, realizing how you can support them as well.
I will add, not only in terms of reaching, seeing if they want to be parent leaders, these are folks who are already in the space and doing this work, right? These are Black-led, Black-founded organizations. And so when we talk about not necessarily needing to reinvent the wheel and figuring out ways to better partner and lift up and collaborate, these are some of the leading organizations that are doing this work in this NICU space.
Thank you so much for that comment, Dr. Asiodu. It's very, very important not to reinvent the wheel. It's something that we strive and say that we should engage our community partners that are always doing the work. And our NICU toolkits are definitely still available. They're going to be, website is right here. It's just going to have you go through a survey, because we're collecting data to see who's using the toolkits and kind of why. And we'll go over what we have found so far. So the toolkits have been downloaded actually over 500 times across the country in 38 states, as well as Canada, Colombia, and the UK. So even internationally as well. So that's very, very exciting. And we want to thank you for listening to our presentation, and we can transition to a Q&A.
Okay, there we go. Thank you so much for that. Let's go ahead and just start going through the questions that were submitted. And if anybody here that's in attendance today has additional questions, please feel free to put them in the chat box. So just going down the list, how much information about health risks for Black women do you think should be shared during pregnancy? It's a hard balance between preparing and not scaring. What is your thought on that?
This is an interesting question. I think a better question and a better way to think about it and frame it is really talking about the systemic and structural racism and systems of oppression that place Black women and birthing people at greater risk, right? Being a Black woman or a Black birthing person or a Black family is not the risk factor. It's the everyday lived experiences within within systems that perpetuate racism, that perpetuate harm. And so I think one of the first things we can do is reframe that, because part of, I think, the concern and the what causes folks to get scared and nervous is that we talk about it in the sense of that individual, that family, they're the problem or they're the risk, when it isn't the case. It's really the systems that folks are engaging with that perpetuate harm onto them, right? And so
Mm-hmm.
I think if we reframe that and work on dismantling those systems and structures that perpetuate harm, then we can create environments where everyone has more equitable and safe birthing experiences. Now, of course, I think it's important to provide anticipatory education and anticipatory guidance, but it's the way in which it's shared and the lens to where we take the onus and the risk factor off of the individual who's in front of
Mm-hmm.
us and talk about it more in the sense of, given the lifetime experiences and exposure to racism and harm that you've had, here are some resources. These are the things that we need to look out for and be aware of, given the historical and current potential harms and exposures that individuals and families are experiencing. I hope that makes sense in the sense of,
Yeah.
it isn't on the individual or the family. It's really about
Right.
the systems and structures that they have to deal with and that they have to
Yeah.
experience.
Yes, I think that's a really, really interesting and powerful way to think about it. I recently heard Ruchika Tulshyan, who wrote a book called Inclusion on Purpose, and she wrote an article about, and it was titled "Stop Telling Women They Have Imposter Syndrome," because that puts it on the woman when you're not addressing the system, the patriarchal, corporate system or healthcare system or whatever that system may be, and that's really the key to focus on. I think that's very important. So let me ask you this, because this, especially with NICU Parent Network, we are a collaborative of organizations. 90% of our members are led by white women, and most of them have, predominantly white support staff. And so we do have a question. We currently run an organization that is all white NICU support staff. So what do we need to do to be better support resources, better advocates? In this position, what do we need to do to do better and be better?
I think one of the first things, and I think Kira and I have talked about this in the sense of doing the internal work to create an environment which would be inclusive and supportive of Black families, of Black NICU leaders wanting to be in this space, right? I think so oftentimes we focus so much on recruiting diverse individuals to join predominantly white organizations, without those white organizations doing the work to ensure that the space that they've created does not perpetuate more harm and perpetuate more stress for those individuals that they're bringing in, right? So I think first it's doing the work internally to ensure that you are cultivating and fostering a space of equity and inclusion and accessibility. And then again, reaching out to those who are already doing the work, and not in a way of tokenism, but really in a true way of collaboration, right? And really understanding that these folks are doing this work in their communities, they're leading in this communities, and how can we come together and partner to better serve all families, right? And I think it's also
Absolutely.
about sharing resources and sharing financial resources. Oftentimes, our racially minoritized led organizations are not as funded or as financially supported as some of the larger white led organizations. And so it's about sharing power, sharing resources, sharing financial space to really create more equity. Mariana, do you have some thoughts on that?
Yeah, I definitely think that you hit the nail on all of that. Of course, we want to do, I feel like a lot of the times it's, how can we, a lot of times organizations come in thinking that, they need to reinvent the wheel, which we always say, but always collaborating with the community organizations because they're doing the work. They know what the community needs, and you going to them and asking them how you can support them. I feel like it is also like a give and take relationship. Like, how can you support them? And then they can support you. And so just making sure that we are doing the internal work, but also figuring out how to collaborate rather than like just being like here and, we've done the work kind of thing.
Right. Absolutely. Thank you for that. So I thought that this was a really poignant question because it is the reality that that many families experience lack of care, poor care. I mean, your study clearly showed that lack of communication, lack of sharing resources, information, education. So, what do you do? How do you acknowledge the reality of that after the fact? So, um, does that question make sense? I guess the question is being asked if a family has this experience, brings it to someone's attention, what is the correct response to support that family better?
Mariana, do you want to go first, or do you want me to take that?
I feel like it's just asking them like what they need, where their headspace is at, and acknowledging. And I feel like and this is why, this is why diversifying the workforce is important, because a lot of the times I feel like Black families are coming in and people are like a lot of the times I'm not saying particularly like your NICU leaders or anything, but white clinicians, even with the first questions, is like we're talking at them, we're giving them these resources, and it's not really like an open discussion on back and forth on how we can meet their needs where they're at, because they know what they need, and just us talking at them, making sure that we're partnering also with our patients and the people that we're supporting, and asking them and figuring out where their need is and giving them the support. The community organizations particularly that are Black led, and giving them those resources to help them meet where they're at, and definitely checking in very regularly. When it comes to mental health, making sure you're doing those mental health screening, or making sure you're giving them resources to get those screenings done and get the care that they need.
Yeah, and I think to add to that, it's first acknowledging those experiences, right? Oftentimes when those type of experiences are shared, we often hear defensive responses, right? Well, no, that doesn't happen at our institution. We treat everyone equally. That wasn't, that isn't us. That's not how we do care. That's just not, that doesn't happen here at our hospital or within our NICU or at our institution. And that perpetuates even more harm, right? Because it takes a great deal of strength for families to advocate for themselves and say, you know what, I didn't have the experience that I should have had, or I believe I had, but I want to make this better for other families in the future, right? And or make it better for themselves. And so I think first it's acknowledging that these experiences are happening and not going on the defensive, and really listening and making space for other families to also share their experiences as well.
Yep. Our board president, Gigi Kanyangwa Fernandez, always says there is great power in the pause. Don't always, be ready to defend or explain, but pause, listen, really listen carefully. So what is one thing that we can do as parent support organizations to better the experience of Black families? Like, is there something above all else that you would tell someone listening today that they should start doing today?
I think the comment that Dr. Akafel has placed in the chat is one of the key things in terms of understanding that not only is there a historical medical distrust or mistrust, but there's also currently medical and healthcare mistrust and distrust that families are experiencing, right? Oftentimes folks will talk about harms that were done generations ago without acknowledging that some of those current harms are happening right now, right? We are not there. The fact that we have the highest maternal and mortality and infant mortality rates are experienced by Black families does not happen in a vacuum, right? And so it's important to acknowledge that some of this is currently happening and create systems and create opportunities to rebuild trust, right? Again, with listening to people and to families and making space for their experiences, and then also examining, and this is, I think, Erica placed, and this is exactly where I was going in terms of thinking about re-examining what are the policies and practices that are currently within your NICU environment or within your organization that are perpetuating harm. Even policies and practices that you may feel are neutral or in perpetuating neutrality could be perpetuating harm for other families. And so really taking a look at it and being vulnerable to take a step back and looking at the ways in which we're currently providing care, providing resources. Just because we've always done it a certain way does not mean that it has to continue to be that way, especially for seeing inequities and disparities in the care that we're doing. And that's another thing in terms of really looking at the data and deaggregating it and looking at it across race and ethnicity, looking at it across insurance payer, looking at it across geographical location, right? Because sometimes we'll often hear, well, we don't have a very high Black patient population, so this doesn't really pertain to us. But you may have a higher Latinx population, an Indigenous community population, an Asian community population, or even a rural white population where there are differences in the way in which people are being treated in their healthcare outcomes, right? And so we focus on anti-Black and racism and Black families because what we found is when we focus on the families and communities that experience the highest burden or have the poorest outcomes, when we focus on improving their outcomes, we ultimately improve care for everyone, right?
Right. Absolutely. Beautifully said. So what about, let's see, we have a question that says, how do we best address communication struggles between medical teams and families that are based on cultural differences? So I think this question is if, we know that these implicit biases exist and are playing into the communication capabilities of the medical team. How do we address that?
I think first looking at the diverse makeup of the medical team, right? And I think this is in terms of thinking about the healthcare workforce in general. We need to not only recruit, but retain a more diverse workforce, but also thinking about how are we utilizing individuals with lived experiences? Is there an opportunity for a peer support program where people who have had lived experiences in the NICU can be a part of the healthcare team to be navigators, to really help interpret some of the information that may be more challenging for families to digest. And maybe they have a little bit more time to really sit with families and to really talk through and help them understand what's going on and make decisions. Thinking about that, but also talking with families. Sometimes the way in which we provide information isn't what's best. Sometimes visually depicting what's going on in terms of using visuals, making sure that we're using language concordant documents and diagrams, and we have translators available and things of that nature. But I think there are a number of different ways that we could meet the needs of different families. We just have to kind of think outside of the box. And Marianne, I know you had some thoughts around this as well.
Yeah, I think of it as when there's a cultural difference, sometimes it's not just that. Sometimes it's a time pressure. A lot of the times it's like healthcare professionals are time crunched. They have a lot of families, and a lot of the people that, kind of fall through the cracks, are people of color and Black families. And so I think a big one is knowing their rights. If you're going to be a person that's supporting NICU families and going to be there supporting them at all, just making sure that they know their rights. A lot of times there are patient advocates advocates at hospitals. There's a way to get them involved in making sure that they understand everything that's going on with their care. That's definitely a resource that I didn't know about as a NICU parent. I found out when I was a nurse, became a nurse in my pediatric rotation. And so making sure that they know that, and they know, specifically that they need a translator or whatever, because we do have like Afro Latin family members, any of like that, that they have the right to have a translator, and they have the right to make sure that they understand what's going on with their healthcare, especially with their, it's a different dynamic when it comes to your family, when it comes to your babies that are in the NICU, and just like acknowledging that and making sure that they know their rights is a big one.
Yeah. So Dr. Asiodu, I know that you have a class to teach shortly. Can we do one more question?
Yeah, there's a question, and there's two questions in the chat box that I wanted to talk on in terms of, Andrea placed a question in terms of the donor milk discussion, and do people who donate breast milk have to divulge their race? And do Black families in the NICU ask this question, what race donated milk for them and for their baby? And I don't know that that's necessarily, it's not necessarily focused on race. I do sit on the HBANA, the Human Milk Banking, Human Milk Banking North America Association. I always have to remember what HBANA stands for. Right. I sit on their health equity task force. And this is something in terms of collecting data in regard to who's making donations to the milk banks, and also who's receiving the milk that is donated from the hospital. It's important, right, in terms of thinking about how can we better engage racially minoritized communities to participate in the donor human milk process in terms of donating excess milk, or just raising awareness in regard to the options and opportunities. It isn't necessarily the question in terms, at least in my experience, about the race of the donor. Families want to know where the milk comes from, right? They have questions around where it comes from, how it's processed, things of that nature, and so is it just an individual talking about pooled milk, things of that nature? They want to know how it's processed and then the benefits, which makes complete sense, right? And so while we're talking about the importance of donor human milk, also talking about the processing. And this is something we are talking and trying to work with donor milk banks across the country in terms of increasing community awareness around pasteurized donor human milk, the processing, that it's safe, that it's one of the best options for infants if mother's own milk or the lactating person's own milk isn't available immediately after birth, and things of that option. And also having discussions around community milk sharing, which I know is a completely different topic, but also something that, given the infant formula shortage that we experienced last year, we saw increases in, right, in terms of folks relactating, wanting to utilize pasteurized donor human milk, but also engaging in community milk sharing. And so these are all important discussions that we need to be having with our families, but also making sure folks are doing all of these things safely.
Yeah. And I do want to point out Dr. Okafor's comment that it's important to remember that Black families are not a monolithic culture as well. A lot of the experiences had are similar because of skin color. And Mariana, you certainly touched on this with the Afro-Latino families. And that is a very good point too. And when we talked to Kimberly, the director or founder of Sol's Light, she's always very clear. I don't speak for all Black people, but I speak for, my experience and those that I've supported. And that's very important to keep top of mind. Again, speaks to the importance of engaging with, collaborating with, partnering with the people that like you mentioned, the community organizations that are, feet on the ground doing the work in the community.
Right. And then I think one other question, Aaron,
Fred, Aaron,
in terms of the
about
qualitative interviews,
Mhm.
we did have a semi-structured interview guide, which we created in collaboration with our community partners and built off of the survey, so that there were certain aspects of the NICU experience that we wanted to delve deeper in and really asking individuals and families to share more deeply in regard to their experiences, because you can only capture so much information on a survey. And oftentimes the nuances of those experiences are missed sometimes in a survey. And so we did have some structure to that. It was open-ended discussions that we built off of what was the responses that were shared and asked follow-up questions. And they did differ from the survey questions, and some aligned, but we wanted to know more deeply and have a deeper understanding of those lived experiences in the NICU.
Thank you for that. So I guess before we close, do you have any final comments or final thoughts, Mariana, that you want to share?
I just want to thank you for the opportunity. I appreciate you wanting to hear about this and our study and the toolkit and how you can use our toolkit. And just this is like a very important, robust conversation. And like Dr. Asiodu said, if we focus on Black families, it'll improve the health for everybody.
Right, absolutely. Dr. Asiodu, any final thoughts or comments?
Again, I echo what Mariana shared, and just thank you all, and Kira for the being very, very persistent in terms of making sure we are here and have this discussion. And so I thank her for really wanting to make sure that we were able to engage with you all, and just thank you all for the work that you're doing. And I'm hopeful that this will be the first of many discussions with this group and opportunities to share in terms of the work that you all are doing and the work that we're doing, so that we can really provide more equitable care for Black families, yes, but all NICU families as well.
Yes, absolutely. Well, thank you so much, both of you, and to everybody. We will certainly send the link so that you can access the toolkits, and any additional questions, feel free to send our way. Thank you, Dr. Asiodu. Thank you so much, Mariana, for all of your work and your time today. We really appreciate it.
Thank you. And I know there was one other question around an article. I will send that article to you, Kira, for folks
Great.
Who wanted that. And then also, again, the NICU toolkits are available on our website, so feel free. They're available for free. We just ask that folks complete a very short survey. It lets us know how they're being utilized, and that's helpful as we're hopefully seeking more funding to do more research around them. We really want to know how they're being utilized, how it's helping others, families, clinicians, NICU environments, institutions, things of that nature. If you have any difficulty or challenges with downloading, just send us an email. We're happy to send another link over to facilitate that. But again, thank you all so much for your time this morning and or afternoon, depending on where you are.
Thank you so much. Have a great day, everybody.